All right, good afternoon, everyone. We're going to give folks another minute or two to finish joining, but we do appreciate you spending some time with us this afternoon to talk SEND and Population Explorer. So we'll give folks maybe till two after, and then we'll get started. Give folks another minute. Alrighty, I think we can go ahead and get started. Welcome to our CRISP Send and Population Explorer training. My name is Kevin Phillip, and I work as part of our user engagement team here at CRISP. Our goal is to create content and guides and things on our website so that individuals and users can make the best use of CRISP tools and understand exactly what our offerings are. If you want to reach us, you can email mdcommunications@crisphealth.org, and one of our team members will be able to direct you to the best place or answer your question. Before I get started with the presentation today, I did want to cover some housekeeping items. So firstly, we are recording this webinar and we will share the recording with all attendees as well as the slide deck. So you don't have to worry about that. That will come to your inbox. We'll also publish them to our usual channels, our website page and our YouTube channel, so that other folks can find them. So if you have a colleague who can't attend live today, you can always point them to the recording or the slides for reference at a later time. We do have the lines muted just to avoid distractions as I'm going through the presentation. However, we do encourage questions. So if you have any thoughts as I'm going through the slides or the demo, feel free to drop them in the Q&A feature, and we'll have some time at the end to answer those questions. I'm hoping that I'll be done with everything within 45 to 50 minutes, if not earlier. So we'll at least have 10 to 15 minutes of dedicated time to answer your question. If we can't answer it live today, then we will follow up with you offline by email so that we can best answer your question. And then if you do have any other questions after this training and you're watching it, you can email our support line, support@crisphealth.org, and a team member will be able to direct you to the correct place or answer your question there. Um, Try, if possible, to keep the questions as general as possible. If you want to know something specific with your organization or account, it might be hard for me to answer that live. So we just ask that try to ask things that I can answer, and that would be helpful for the rest of the group today. I think with that, we can go ahead and get started with our background. So first, I want to cover what SEND is. It stands for CSS Event Notification Delivery Service. And folks may or may not be aware of this, but we actually partner with a parent organization called CRISP Shared Services. That's what that CSS acronym stands for. Essentially, what they do is take some of the technology that we use here at CRISP and also make that available to other state HIEs. And CRISP, Maryland, is one of the affiliates of shared services. And CEND is the notification delivery system built by CSS, and it is a near real-time notification solution that keeps care teams informed when their patients receive care, regardless of where the care occurs by delivering timely alerts for admissions, discharges, emergency visits, and other clinical meaningful events. CEN enables organizations to act fast, coordinate care effectively, and reduce gaps across the care continuum. It is designed to support proactive outreach and intervention, ensuring that providers, care managers, and payers know when to step in. And this may include things involved in follow-up, such as scheduling follow-up care, deploying resources, or trying to prevent avoidable readmissions in the future. The way SEND works is organizations who participate with CRISP send us their patient panel. This is a list of rosters in which you have a treatment relationship with. And what our team does is we monitor, or what the SEND system does is monitor incoming data from hospitals and other organizations, such as ADT and other data feeds, to send notifications when there is a qualifying event. And then these notifications, when that patient activity meets the defined criteria, are generated and then delivered through a defined delivery method. And I'll cover those in a second. But this allows for those care coordination teams or providers to and or payers to take action and follow up and provide outreach to those patients. Um, it's built for scale, so it leverages our patient matching algorithm, standardized clinical care, and proven delivery mechanisms. The notifications are delivered in near real time, enabling timely decision making without adding operational burden to care teams. That diagram there kind of illustrates what I was talking about at the beginning, where it all starts with a patient panel that organizations send to us. This next slide covers a little bit more in detail what patient panels are. Like I said, they are a list of patients in which your organization has a treatment relationship with. There are other use cases for panels, such as supporting patient search throughout our portal system. But the SEND system is one of the main use cases of panels. What are some of the other use cases of send and these notifications? Why are they valuable and why are they important? We came up with five uh, kind of categories of reasons. Firstly, they help with emergency and inpatient awareness. So our encounter notifications are delivered and they help providers know when patients are being seen in emergency department, where they are in that process in terms of being admitted, discharged, or transfer, and then they can decide on what the best follow-up care coordination activity is for those patients, depending on the state of their their encounter. It helps with care management and follow-up. So you can use some of the tools and delivery methods that we have to kind of create a list for yourself to decide on outreach for patients who are been discharged. You can use some of the filtering mechanisms in um, the Population Explorer delivery method to decide on if there are certain categories in which you want to follow up care in terms of people who have had many ED visits or are high risk for certain type of events. It helps with population-based monitoring, where you can track specific patient populations in terms of your panel and be alerted for when those key events occur. Um, um, Outside of just care coordination teams, lots of payers use the CEND system, and this helps with their downstream ingestion, prioritization, and deployment of care coordination activities for these notifications. Um, Lastly, the system is very customizable, so it can support specialized and time-sensitive scenarios, such as hospice coordination, post-operative monitoring, maternal health risk identification, and overdose awareness, and others that aren't even mentioned here. So those are some of the primary use cases of our SEND system that we kind of broke out into those categories. So how do you actually get these notifications? So there's four main ways that organizations will choose and select to have these notifications delivered. One easy way for many users to have access to these is through our Population Explorer tool, which is embedded in the HIE or CRISP portal. Um, it is a self-service application which allows you to do filtering on the near-time encounters and other notifications that you receive in the tool. You can track follow-up status by using the follow-up feature in that tool, and you can export this data in various um, formats that allow you for greater data analysis if needed. We also have EHR integrations where we're sending these to EHRs such as Epic and Basket. This allows for embedding these notifications and alerts in clinical workflows. We have HL7 messages that are near real time. These structured notifications are sent to secure endpoints for organizations with technical integration capabilities. And then we do scheduled bulk delivery files via an MFT folder. And we can support this on a daily or weekly basis. And this is ideal for organizations who want to have one person drawing down these alerts to their systems for other management. We don't support this in real time. However, daily is the most frequent method, or the most frequent. We will be sending those files to MFT folders. So those are the four ways. The Population Explorer tool is in the CRISP portal. This is what I'll actually be demoing later in the presentation, but I just wanted to give you a sense of what it looks like. So this is a picture of it, and it allows for kind of some software to be on top of the notifications to allow for kind of some manipulation within the portal itself, rather than it being sent to you in a different work stream. One more thing I'll say about delivery methods: if your organization is only using Population Explorer and you want to kind of find out more about these other methods, you can always reach out to our support line, or if you know who your dedicated CRISP account manager is, you can reach out to them and they can help facilitate the discussion to see if your organization has the integration of capabilities for some of these. In particular, the middle two, the EHR and HL7 messages. Um, Most organizations can be set up with a MFT. We typically just ask that there be one source for an organization rather than multiple. So the benefit of the Population Explorer tool is all of your clinical users can actually have access to this through the portal. More about that later when I get to the demo. So you might have picked up on, as I'm talking about these notifications, I'm not just talking about encounters. And that is because our SEND system actually supports multiple different notification types. We have four main ones. I know the screen here only says three, but we do have a relatively newer one that I will cover in the next couple slides. But what's important takeaway from this is our CEND system supports more notifications outside of just the traditional encounter-based alerts that most users are used to. We call those standard notifications, and these are when you get notifications on basic patient activity, such as those admission, discharge, transfer visits, emergency room, and observation visits. Um, and these notifications rely on an event type and patient class and are ideal for general care coordination and transition of care activities. Then we have our second notification type called logic-based alerts, and these are what are generally way more customizable. Um, these need to be set up separately for your organization and are not the default information that you will receive through any of those delivery methods that I mentioned. Um, these are triggered with some combined data or that meet a specific defined clinical scenario, and they support more targeted use cases such as managing of chronic conditions, maternal health, and post-acute monitoring. Again, with these, you need to set them up separately. So I'd reach out to support or our account manager if you're interested in receiving those logic-based alerts. Um, through those delivery methods that I mentioned. The global notifications in Population Explorer, these are available to all Population Explorer users and kind of our default logic-based alerts that are already built into the system. Currently, we have two offerings under that. We have our non-fatal overdose. So this is when we get a non-fatal overdose event piece of data from EMS services or hospitals, and then also death indicators. So if we receive vital statistics data or hospital data on a patient expiring, those will be part of the global alerts. The fourth type that is not shown here on the slide is our preventative services. I do have a slide on that in a second that we can get to, but I'm going to run in a little bit more detail about these different notification types. So again, our standard notifications, these are like our encounter-based alerts. They are shown in Population Explorer if you're looking there as like a white icon, and then they turn gray when you are looking at one specific record. And that's what you're seeing on the screen. So these are emergency room visits, inpatient admissions, discharges, observation encounters, readmissions, and high utilizer alerts. Then our logic-based alerts. So these are the custom ones that I was talking about. And here is a sample of some of the ones that we offer currently. If your organization has another use case that you want to float by us, we can also have a conversation about if those things are possible with some of the more data insights team that we have. But we offer these custom logic-based alerts for high-risk pregnancy, pregnancy complications, labor and delivery, maternal health-related alerts, chronic condition follow-up, including diabetes and other chronic conditions, lane encounters, specialty visits, mental health follow-ups, and post-surgical and diagnosis-based monitoring. Again, these are not set up for everyone standard in Population Explorer. It's something that you have to request of our team. The logic-based alerts that are called global notifications, and these will show up as yellow icons within the Population Explorer tool. That's what you're seeing here. This is actually a death indicator one. But the logic-based alerts will also show up as yellow if you do have them set up in Population Explorer as well. Over the past year, we actually have released and started implementing preventative service notifications as well. Currently, we have colorectal and breast cancer screenings available, and they will show as a green icon in the Population Explorer tool. What's cool about this is you will see kind of in the screenshot that there's a specific section dedicated for the preventative service that gives you a little bit more details about the actual service provided. But what you can do with the Population Explorer tool is you can actually click through to the patient's record in our CRISP system that allows you to actually pull up that CCD document that we triggered the preventative service notification from. That will give you more things like the result of the test and things of that nature. So this tool works really in tandem with our clinical information service or in context tool within the CRISP portal. And um, you actually can access Population Explorer through the CRISP portal this way. So I think with all of that background out of the way, I'm actually going to pivot now to just do a demo of Population Explorer, and then we'll come back to our slides here to answer your questions if there are any. So give me a second while I change screens here. I'm going to be pulling up our demo site or our staging site. And all of the data that you're about to see for the Population Explorer tool is demo data. So there is no PHI being displayed. I'm just signing in here. Alrighty, let's share my screen again. All right, so now you are seeing the stage portal. So on the left side of the screen, you'll see the patient search and the other applications that you have access to. And if you have Population Explorer set up on your portal, it will display on the right side of the screen. Um, the first time you log in, it will have an empty window here for you to select your panel. Most organizations will just have one panel that they submit to CRISP, which is their current patient roster. However, there are situations with our larger health systems and bigger groups that they actually send in multiple panels for various reasons. They might split it up by chronic condition or special interventions that are being run on the one set of patients. So you may have access to multiple panels in which you can toggle between by selecting this dropdown. For most users, they would just select one. And then once you have a panel selected, your notifications will display there at the bottom. Um, these do look a little small, but what you can do is you can actually expand Population Explorer to cover the width of the portal itself. We call this the expanded view, and this is what view most people will do their work in when they're using Population Explorer. Alternatively, you could also have the option to collapse the full view here if you are working somewhere else in the portal, and you don't want to be distracted by incoming notifications in the system. So what you'll see in this collapsed view is just some brief information about the notification, and they will display from most recent to oldest at the bottom. They display brief demographics and then the notification type and then the facility that they came from. This admit date here for things like outpatient encounters is kind of like a forced piece of information. It's not really saying that they've been admitted at this time. It's just the date that the service was taking place if it is an outpatient one. If it is an inpatient one, which I don't know if there's one quickly here, that admit date will actually be the admit date that they were admitted to the hospital. So I just wanted to clear that up while we are looking at that outpatient encounter. Um, So from this view, you could actually export this data to Excel, or you can click this button to see your export history. You can also click this button at the bottom to refresh the information to see if there are any new alerts available for your panel. The way the alerts come in is about every 20 minutes they're fetched, and then what happens is there will be a little alert icon here at the top telling you that there are more notifications available. And at any time, you can click that to generate the alerts, new notifications that have been registered to your group in this system. The reason why we do it that way is sometimes people are below in the table, and the way the software works is if we didn't have that kind of caching method, is they would just continuously appear and then users would lose their place in the table or wherever they're working on these lists. So that is why it is done that way. I'm gonna display the expanded view in a second to talk about all the features there, because that's really where most people will be using Population Explorer. But I did want to cover some settings. So that gear icon that I just clicked here is how you get to the settings. What you can do in the settings is you can select a default panel, and so this will automatically load when you load up the portal itself, and you won't have to do the uh, clicking to select a panel, but rather that will display. Filtering, we'll talk about later, but what you have the option to do is set a default filter. For example, if you are a care coordination group and you don't want to see outpatient encounters, what you can do is you can set up a filter to basically exclude those encounters and then have that saved as your default filter. So that you only see, inpatient observation and emergency room visits. Default widget view. This is good for people who um, maybe are always using Population Explorer. If you want to set it to the expanded view to display, that means every time you come to population or the CRIS portal, the Population Explorer tool will be expanded to the full breadth of the screen. We recommend folks just keep it at the normal view because they can use the patient search if they need to, but that is an option for folks if they so choose. Download size, I forget offhand what the default settings is, but you might want to check that if you are planning on downloading data and try to set it a little bit higher. The only thing with setting it higher is it might take a little bit longer for the download to actually populate, and the system might have to do that. And you might just need to come back to download the data as that file is rendering. All right. The default load period. So you can set it to only focus on a certain period of time if you want to, as we know that there are some organizations that have many, many patients on their panels, and that can be quite overwhelming to get to see all of those, especially in a data download. So you can customize that. Recommend most people keep it as all unless you're an advanced user who's doing something like that. You have the option to hide the follow-up status management system here. I'll talk about that a little bit later, but just know you have the ability to turn that off if you aren't going to be using that feature. You can enable notifications to auto load. I gave the rationale of why it's not automatically set that way. Um, but you can change that if you want to. And then also you have the ability to toggle on and off this advanced filter builder, which I'll cover later. All right, so let's go to the expanded view and you can start seeing how useful the Population Explorer tool can be. So what happens when you hit the expanded view is you will notice that these notifications move to the left side of the screen, and then this middle section with a lot of details appeared. We call this the detail tab, and then we also have another tab that is a tabular view or a table view of these notifications. So what happens when I click down into a specific record is the details will display here. You have the option to collapse all of the different tabs for the details, or you can expand all of them with the plus and minus arrow. You also have the ability to export just this patient's details, this record here, to a PDF or Excel. This top export button, which I'll come back to, exports all of the listings in the system across these 20 pages that the notifications are listed out. But this one just exports the one that is selected. I'm going to come back to cover all of these different widgets here in a second, but I did want to touch on the table view. The reason why you might use the table view is primarily for this follow-up status feature, which we have for not started, in progress, complete, and no planned follow-up. The cool thing about this feature is if you and other users at your organization are working on the same panel, you can kind of flag to them where you are in the follow-up of that patient. This is also good for one individual who's managing care coordination at your group to be able to know if they've called the patient or whatever. You can kind of use these statuses to mean whatever is meaningful to your organization. And you can also suggest to us if you have additional ones that you want to see added. They also are color coded, so you can quickly spot some differences here. You can see there's complete is green, not started orange, no planned is gray, and then is there another one? What's not started? Say, oh, sorry, that's orange. Yeah, orange, blue, gray, and green. You can also customize the columns that you're seeing here. If you click one of these arrows next to any of them, you can see the various columns that are available. You can add those in. All of these settings are sticky, and what I mean by that is every time you come into the tool, however you last left it is what you will see. So once you have a good setup, I recommend not moving around things too much so that you always see what you want to see when you're looking at the table view. The other thing I just did is you can actually drag columns to be in different orders. So you can always see the information that you want. And that can help you with your care coordination use of the follow-up status. All right, so back to the detail view. In the detail view, once you have a record selected, again, it will fill out all of these widgets. So the follow-up status is kind of what I mentioned in the table view. The other information that you'll see is when the follow-up status was last modified and by whom at your organization, by their portal email address. There is a follow-up status history here at the bottom where you can see all the changes for this particular record. This is quite a lot, but this is, what we use for demo. Then you'll see the patient's demographics. And so this is information that we have compiled on the patient's record that we have at CRISP. So you may see fields that are blank, means that we don't have that information, or that information is not applicable to the patient in terms of date of death. Notification details. So this will only appear if the notification type is a global or logic-based alert. Um, so unfortunately, in this demo panel, I don't think I have any logic-based alerts. I do have one global alert that we can come back to, but that's why this section is blank for this particular patient because it is an encounter notification. Panel details. So this is information that you provided to us on the patient panel for this particular patient. Um, Organizations might share more information to help with their um, data analysis or care coordination on their panel. Um, so you can see here we're basically giving you a chance to filter on some of the information that you've already sent in to us on panel. For example, if you um, on your panel have different, if you're a ambulatory system and you have multiple practices, you can basically flag what practice the individual goes, and then you can use the filtering here to filter on this field. So that's essentially why we have these panel details, which is information you have given us on the patient um, displayed there. It's for further um, filtering. The selected encounter details. So this is the primary section where you're going to see information about this specific encounter notification. Um, Unlike other notification systems, ours will keep one continuous record for each step of the process, let's say. So let's say, for example, if this was an inpatient encounter, for example, and they haven't been discharged yet, um, these fields will be blank. And then once they are discharged, those fields will be updated. And then that record will repopulate on the top of your list, but this information will be the same. You won't see two records for one for their admission and then one for their discharge, for example. So that's a little bit different here, but we have found and have had user feedback that that is helpful to basically have the encounters rolled up into one single one so that folks can see all that information in one place and it's continuously updated. So this is all coming from the ADT itself. So you can see things like the type, the facility source, the diagnosis code, the primary diagnosis code, provider, and insurance if it's given on the ADT itself. Um, So those are encounter details. Preventative services, much like the notification details, will only show up for preventative service notification. I actually don't have one in the demo environment to share, but that is where you would find that. Um, Risk details, this is more information that is available on your panel. Some organizations will send in risk scoring that they have on the patient through various care coordination programs or reports that Chris might provide. And then it's helpful maybe to do some filtering on that when they're looking at things. This aggregate details gives you a quick overview of the visit and visit types that users have had over the past 30, 60, 90, and 100 and a full year worth of days. So you can quickly kind of scan and see if they're a high utilizer, and you can also do some filtering based off of those kind of compiled statistics. Diagnosis details. So this will show you primary and even secondary diagnosis here. We'll give you the code and then also the description for the diagnosis as well. Encounter history, this will show previous encounters that the individual has had that are separate from this encounter. This patient doesn't look like they had any prior to this one, so that's why that one is blank. All right, so let's talk about filtering for a second. So filters, as you scroll through the filter here, you'll see that we offer basically a filter on every single one of these fields that you saw throughout all of the tabs, which is awesome, but also a little bit complicated for folks to kind of wrap their head around. Um, we have different types of filters. So, what I mean by that is um, the value input will be slightly different. We have free text fields, which is what this one is, that allows you to put a string of text for what you want to see. Um, we have time-bound filters, such as the emit date and time. Um, you can have one of the pre-selected ones, or you can make a custom one where you look at a specific date range that's not one of these defined period of time. We have some that are a pick list. So if I go to encounter type, it will actually display the four different types that we have in the field itself. So this is a great one. If you want to just look at inpatient encounters, for example, you can add that in. What you can also do with filtering is you can add in um, filters of the same type, and what they will do is it will look for any encounters that are inpatient and look for any encounters that are observation. Um, the um, the when you have filters that are opposite categories, so this facility, for example, if I add in, I want only facilities that contain the word demo, for example. But what this is looking for is it's looking for any facility that has the word demo, and then it's looking for of those um, um, any encounter type that is inpatient or observation. So to kind of restate that, if you're using a filter that's the same filter type, like this encounter type, it works as an OR function. And then if you use a filter that is a separate field altogether, it works as an AND function. Hope I explained that well, but you can ask a question if I didn't. But so this one, for example, is just looking for data at facility that contains the word demo, and then that is inpatient or observation. So if I scroll through, you should be able to see that. I don't know. Yeah, here's an observation encounter versus inpatient encounter here, and all of those contain the word demo. Once I have a filter that I like, I can actually opt to save that. It's best practice to give it a name that you'll remember. Um, and then you can save it, and then you can come to save filters here, and you can select which ones you want to load. I'll just load a different one just to show you that how that works. Um, Again, in the settings, you can set up a filter that you want to always come back to. So folks who are working with for only want a certain type of notification under a certain type of conditions, you can save that as your default view, and whenever you pull up the portal and Population Explorer app, it will automatically go to that set of filters. To clear your filter, you just click this, and then it takes you back to viewing all of the encounters. This display type, I'll just cover briefly. The notification types is what you're filtering here. So you can just look at encounters if you want to. You can look at global or notificate or logic-based alerts, and then preventative services in that as well. It will default to all at the beginning. So you don't have to change anything if you want to see all of them, but if you want to look at a subset, you can do that as well. Let's cover exporting really quickly. When you hit that export button here at the top, it will ask you to confirm that you are about to download PHI. But then it brings you to an interface where you're actually able to select what you want um, to export. So you can select all the fields, you can select none, you can select whatever ones that you want. Um, and what's cool about this is whatever settings that you've had will automatically save for the next time. And then what you can do is kind of change the order of what is exported. So, for example, if you always want the patient's address, let's say, um, to be there, that will be in the list like this. So restated, your Excel file that this comes out with, this top field will be the less leftmost column, and then this will be the rightmost column. And what you can do is kind of customize that on the front end rather than have to um, do that in Excel. Um, a little confusing, but what you do is like you click through and then you can drag and then you can move these that way, and then you can save changes. And then your settings will be saved that way. Once you're ready, you can hit Excel, and depending on how many um, rows you have, your export might take some time. So this one said your export is requested in the queue, and you'll be notified when it is time to download. So then you can actually exit out of here if I could do that. Um, Let me change the. Sorry about this. I can't find. I seem to have stuck myself in the window here. I'm sorry, I'm gonna just restart. Okay, so I was talking about the export queue. That's what this export history is here. And so you can see this is the one that I just requested. And whenever that download is ready, the indicator icon will appear over that export window there. So it allows you time to stay in the portal, do extra work, and then come back to your download whenever that is ready. Downloads, I think, stay for 72 hours, and then once they have been downloaded, they won't be available to download again. You'll have to re-request the system to actually have that download appear again. Advanced filter builder here, this configure advanced filter. So I don't have time to cover that in detail. It's a slightly complex and a little bit for users who need something very, very specific. I honestly recommend you work with your account manager to set this up if you need it, but this allows for flexibility to create much more complex definition of filtering patient populations by combining panels, by combining those different logic operators that I talked about with all of these data elements. And this is kind of useful in situations where the quick filter functionality does not support significant granularity for the targeted outcome of set of patients, beneficiaries, or events when combined. Okay, I am going to go back to my slide deck and then open it up for questions. I appreciate everyone who has asked a question already. But if you do have any more, feel free to continue to drop them in the Q&A feature. Um, and one other thing, we do have a dedicated web page on our public website there at crisphealth.org that you can find out more information about CEND and Population Explorer. Our user guide is available there, as well as some other shorter videos that cover very specific features that I mentioned. Um, or you could reach out to our support line. or inbox there to ask your question. All right, so um, someone asks, my population explorer does not have any files. Where do I find my panel? It shows no panels assigned. Okay, so this is a good situation to reach out to the support team. They'll be able to look into your account and see what configurations need to be made. It's most likely that it is a issue either with your panel itself, meaning the panel has expired. So when users send in panels, an expiration date is selected. This is just because we know um, in practice, patients churn on and off your active roster based off of their own um, a decision making with their providers. So it could be that your panel is expired or there is something with your specific account that's not configured correctly. Um, so um, you can you can reach out to the support line, sorry, and then you can ask for them to look into that situation for you. I apologize that I can't actually get to the bottom of that, but those are two reasons that that might be the case. Someone asked, not a question, but it would be helpful to see examples of preventative service info given the value-based care focus. Yeah, Charlotte, this is a great comment. I just a follow up to your comment. Do you mean just in terms of the demo here? If that's the case, I actually do have a request to our team to actually add that into the demo panel. So at future demos, I will be able to show you actually how that works, especially through the click through to the um, clinical record. Um, but we have colorectal and breast cancer screening available within that. But I do apologize that our demo panel does not have the preventative services set up. One thing I did forget to show that I'm just gonna reshare my screen real quick and share with you is actually I mentioned there's a click through to the clinical record. So if you come down here and you select your panel, you can click here and it will open up the details. But if you right click, you're able to launch it, that patient's record in the clinical information service. You can also launch that patient's record into some of our other tools, like our screening tool, our referral tool, or consent tool. But most used is that click through to the clinical record to get more information, especially about preventative services. So I did want to highlight that. Right, if you have more questions, feel free to put it in the Q&A feature. But those are some good questions so far. Give one more minute for questions. Appreciate you guys joining us today. Molly says thank you. Thanks, Molly. Thanks for joining. Alrighty. Well, seeing no other questions, I will conclude this webinar. I appreciate you guys joining and look out for the recording and slide deck to your inbox later this afternoon or tomorrow morning. Thanks so much. Take care.